Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. The Omicron variant has now been dominant in Ontario and York Region for over a month. It has dramatically changed everything we knew and how we respond to the pandemic, as well as raised many unknowns. Fortunately, thanks to the work of York Region public health staff and global scientists, we now have some important and very positive new information to share. First, regarding the efficacy of third doses. Second, regarding the potential decrease in cases and easing of restrictions. And third, regarding schools. First, several studies in the US and the United Kingdom last week have made it clear how important the third dose booster of the vaccine is. These studies showed that while 2 doses of vaccine provided between 45 and 65% protection from hospitalization, the booster dose protected almost 90%. Since hospitalization rates and health system capacity are the most significant challenges of the Omicron surge, it has never been more important to get your third dose for your own protection and to contribute to a speedy reopening. We look forward to data from across Ontario and our own York Region data to confirm these findings in the coming days. Second, cases in York Region and across the province seem to have stabilized and may be beginning to decrease. While actual case numbers are not a useful metric since the testing guidance changed several weeks ago, the test positivity rate as well as our wastewater signal are both stabilizing and may be moving in a positive direction. These very tentative but hopeful indications are the reason that the province has announced plans to gradually ease the modified Step 2 restrictions we are currently in. As of January 31st, many businesses can open with 50% capacity, including gyms and restaurants. Capacity limits will be reviewed and adjusted with further easing of restrictions planned for February 21st if indicators continue to improve. While this is positive news, hospital admissions remain very high, and ICU occupancy continues to increase slowly. And unfortunately, we are seeing many deaths. We must remain cautious and vigilant to help decrease the surge of Omicron. Even when restrictions are slightly lifted, please know that this variant is highly transmissible. Observing the continuing restrictions has a direct impact on our hospitalization and ICU admissions. It is very important to protect the most vulnerable in our community and to preserve our healthcare system. If you have symptoms, remain home. Assume you are positive and notify your close contacts right away. If you test positive with a rapid antigen test, please take part in our anonymous survey at york.ca/COVID-19 positive. Here you'll also find next steps and information on how you can protect yourself and your close contacts. Third, regarding schools. As of last week, students have returned to in-person learning, which we know is incredibly important for their social, physical, and mental well-being. It will take some time for parents and students to get used to the new normal in schools, and it's understandable to still have some concerns. As you will know, cases will no longer be reported in schools, and cohorts will no longer be dismissed. However, vaccine coverage continues to increase. Rapid tests have been distributed for use in symptomatic children, and other safety measures remain in place that will help limit the spread of COVID-19 in schools. The most important thing families can do to make sure your children are protected against COVID-19 and are able to stay in in-person school is to get vaccinated. In York Region, almost 60% of children 5 to 11 have had their first dose, and almost 10% have now had a second dose of the COVID-19 vaccine. We have reached 90% of children aged 12 to 17 with 1 dose, and around 87% are fully vaccinated with 2 doses. We are confident that high school and middle schools are in a good position right now, with the best protection we know, being vaccinated. I'm hopeful we can soon reach similar metrics of coverage in elementary schools. If your child has not had their first dose or requires a second dose, they can walk into any York Region clinic right away. You can also book an appointment online at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. For both adults and children, it is important to get vaccinated even if you have had COVID-19. Again, the challenge and the need for restrictive measures during this Omicron surge is the burden of cases in hospitals. Protect yourself and contribute toward a safe and more certain reopening by getting boosted as soon as possible. Approximately 5,000 new vaccine appointments are added every single day, and there are appointments available in many clinics across York Region. Appointments are available for booking between now and the anticipated lifting of measures on January 31st. Please stay healthy, stay safe, and get vaccinated.